Introducing jevtana, indicated in combination with prednisone for the treatment of patients with hormone-refractory metastatic prostate cancer, MHRPC, previously treated with a docetaxel-containing treatment regimen. Important safety information for jevtana. Warning: neutropenic deaths have been reported. Obtain frequent blood counts to monitor for neutropenia. Do not give jevtana if neutrophil counts are less than or equal to 1,500 cells per cubic millimeter. Severe hypersensitivity can occur and may include generalized rash erythema, hypotension, and bronchospasm. Discontinue jevtana immediately if severe reactions occur and administer appropriate therapy. Contraindicated if history of severe hypersensitivity reactions to jevtana or to drugs formulated with polysorbate 80. Please see additional important safety information following the administration and preparation demonstration.
Hi, I'm Kathy Lynch, and I'm an oncology certified nurse. Today I'm going to talk about how to dose and administer jevtana, cabazitaxel injection. Jevtana is indicated in combination with prednisone for the treatment of patients with hormone-refractory metastatic prostate cancer, previously treated with a docetaxel-containing treatment regimen. Do not use PVC infusion containers or polyurethane infusion sets for preparation and administration of jevtana infusion solution. Read the instructions for preparation from the package insert carefully before mixing and diluting. Jevtana requires 2 dilutions prior to administration. Please follow the preparation instructions located in the accompanying package insert. Note: both the jevtana injection and the diluent vials contain an overfill to compensate for liquid loss during preparation. This overfill ensures that after dilution with the entire contents of the accompanying diluent, there is an initial diluted solution containing 10 milligrams per ml jevtana. The following 2-step dilution process must be carried out under aseptic conditions to prepare the second, final infusion solution. Set aside the jevtana injection and supplied diluent vials. The jevtana injection is a clear yellow to brownish yellow viscous solution, if appropriately stored. Step 1. The first dilution. Each vial of jevtana, cabazitaxel, 60 milligrams per 1.5 ml, must first be mixed with the entire contents of supplied diluent. It is important to note that once reconstituted, the resultant solution contains 10 milligrams per ml of jevtana. When transferring the diluent, direct the needle onto the inside wall of jevtana vial and inject slowly to limit foaming. Remove the syringe and needle and gently mix the initial diluted solution by repeated inversions for at least 45 seconds to assure full mixing of the drug and diluent. Do not shake. Let the solution stand for a few minutes to allow any foam to dissipate, and check that the solution is homogeneous and contains no visible particulate matter. It is not required that all foam dissipate prior to continuing the preparation process. The resulting initial diluted jevtana solution, which is cabazitaxel 10 milligrams per ml, requires further dilution before administration. The second dilution should be done immediately within 30 minutes to obtain the final infusion as detailed in Step 2. Step 2, second final dilution. Withdraw the recommended dose from the jevtana solution containing 10 milligrams per ml as prepared in Step 1 using a calibrated syringe, and further dilute into a sterile 250 ml PVC-free container of either 0.9% sodium chloride solution or 5% dextrose solution for infusion. If a dose greater than 65 milligrams of jevtana is required, use a larger volume of the infusion vehicle so that a concentration of 0.26 milligrams per ml jevtana is not exceeded. The concentration of the jevtana final infusion solution should be between 0.10 milligrams per ml and 0.26 milligrams per ml. Jevtana should not be mixed with any other drugs. Remove the syringe and thoroughly mix the final infusion solution by gently inverting the bag or bottle. Jevtana final infusion solution in either 0.9% sodium chloride solution or 5% dextrose solution should be used within 8 hours at ambient temperature, including the 1-hour infusion, or within a total of 24 hours if refrigerated, including the 1-hour infusion. Do not use PVC infusion containers or polyurethane infusion sets for preparation and administration of Jevtana infusion solution. As the final infusion solution is supersaturated, it may crystallize over time. Do not use if this occurs, and discard. Inspect visually for any particulate matter, any crystals, and discoloration prior to administration. If the Jevtana first diluted solution or second final infusion solution is not clear or appears to have precipitation, it should be discarded. Discard any unused portion. The final Jevtana infusion solution should be administered intravenously as a 1-hour infusion at room temperature. Use an inline filter of 0.22 micrometer nominal pore size during administration. The final Jevtana infusion solution should be used immediately. However, in-use storage time can be longer under specific conditions, that is, 8 hours under ambient conditions, including the 1-hour infusion, or for a total of 24 hours if refrigerated, including the 1-hour infusion. The recommended dose of Jevtana is 25 milligrams per meter squared, administered every 3 weeks as a 1-hour intravenous infusion, in combination with oral prednisone, 10 milligrams, administered daily throughout Jevtana treatment. 30 minutes before each dose of Jevtana, administer the following pre-medications intravenously: antihistamine, corticosteroid, H2 antagonist. Antiemetic prophylaxis, oral or intravenous, is recommended as needed. Now I'm going to go through how you properly store Jevtana injection and diluent. Store at 25 degrees centigrade, 77 degrees Fahrenheit. Excursions are permitted between 15 to 30 degrees centigrade, 59 to 86 degrees Fahrenheit, and do not refrigerate. The first diluted solution of Jevtana should be used immediately within 30 minutes. Discard any unused portion. The fully prepared or final Jevtana infusion solution in either 0.9% sodium chloride solution or 5% dextrose solution should be used within 8 hours at ambient temperature, including the 1-hour infusion, or for a total of 24 hours, including the 1-hour infusion, under the refrigerated conditions. In addition, chemical and physical stability of the infusion solution has been demonstrated for 24 hours under refrigerated conditions. As both the first diluted solution and the second final infusion solution are supersaturated, the solutions may crystallize over time. If crystals and/or particulates appear, the solution must not be used and should be discarded.
Important safety information for Jevtana. Warning: neutropenic deaths have been reported. Obtain frequent blood counts to monitor for neutropenia. Do not give Jevtana if neutrophil counts are less than or equal to 1,500 cells per cubic millimeter. Severe hypersensitivity can occur and may include generalized rash, erythema, hypotension, and bronchospasm. Discontinue Jevtana immediately if severe reactions occur and administer appropriate therapy. Contraindicated if history of severe hypersensitivity reactions to Jevtana or to drugs formulated with polysorbate 80. Contraindications. Jevtana should not be used in patients with neutrophil counts of less than or equal to 1,500 cells per cubic millimeter. Jevtana is contraindicated in patients who have a history of severe hypersensitivity reactions to Jevtana or to other drugs formulated with polysorbate 80. Warnings and precautions. Neutropenic deaths have been reported. Monitor blood counts frequently to determine if initiation of G-CSF and/or dosage modification is needed. Primary prophylaxis with G-CSF should be considered in patients with high-risk clinical features. Severe hypersensitivity reactions can occur. Premedicate with corticosteroids and H2 antagonists. Discontinue infusion immediately if hypersensitivity is observed and treat as indicated. Mortality related to diarrhea has been reported. rehydrate, and treat with antiemetics and antidiarrheals as needed. If experiencing grade greater than or equal to 3 diarrhea, dosage should be modified. Renal failure, including cases with fatal outcomes, has been reported. Identify cause and manage aggressively. Patients greater than or equal to 65 years of age were more likely to experience fatal outcomes not related to disease progression and certain adverse reactions, including neutropenia and febrile neutropenia. Monitor closely. Patients with impaired hepatic function were excluded from the randomized clinical trial. Hepatic impairment is likely to increase the jevtana concentrations. Jevtana should not be given to patients with hepatic impairment. Jevtana can cause fetal harm when administered to a pregnant woman. There are no adequate and well-controlled studies in pregnant women using jevtana. Adverse reactions. Deaths due to causes other than disease progression within 30 days of last study drug dose were reported in 18, that is 5%, jevtana-treated patients. The most common fatal adverse reactions in jevtana-treated patients were infections, N equals 5, and renal failure, N equals 4. The most common, greater than or equal to 10% grade 1 to 4 adverse reactions were anemia, leukopenia, neutropenia, thrombocytopenia, diarrhea, fatigue, nausea, vomiting, constipation, asthenia, abdominal pain, hematuria, back pain, anorexia, peripheral neuropathy, pyrexia, dyspnea, dysgeusia, cough, arthralgia, and alopecia. The most common, greater than or equal to 5% grade 3-4 adverse reactions in patients who received jevtana were neutropenia, leukopenia, anemia, febrile neutropenia, diarrhea, fatigue, and asthenia. Please see additional important prescribing information and accompanying full prescribing information, including boxed warning.
I hope you found the information in this video helpful. For more information, please visit www.jevtana.com.